Hello friends, welcome back to my channel Prosthodontics, and today we are going to discuss one of the important topics in prosthodontics, that is aesthetics in complete denture. So this is a very important topic, a must read topic for your university exam preparation. You can also get questions as aesthetics in fixed prosthodontics or implant prosthodontics. So aesthetics as such is a very important topic, and you should not miss this session. Now, to those viewers who are new here, myself Dr. Jolsna, and through this channel Prostho Hub, I discuss some of the important prosthodontic topics that you may find useful if you are preparing for your MDS university exams. Now, before doing this session, I would like to introduce the Prime membership program for the Prostho Hub subscribers. So I'm getting a huge number of topic suggestions and queries regarding various topics, and also requests to share the PowerPoint presentations of these videos. So I have introduced a Prime membership program where you can subscribe to this and get benefits like early access to the new videos, priority reply to your comments and queries, and also I'll be doing the topic that you suggest, and also free access to the PowerPoint presentations. So if you wish to join this membership program, please do go to the description box given below this video, and you can see the link that is given there. You can click on the link and subscribe to this program. Coming back to the topic of today's discussion, that is aesthetics in complete denture, let us see the contents. So introduction, the various definitions, fundamentals of aesthetics and various factors influencing the appearance of dentures, the various steps in achieving aesthetics, the important one, that is the dynesthetic concept, the dynesthetic outline, the errors in aesthetics, discussion, conclusion, and finally references. So if you have any queries or feedbacks, you can either comment below this video or you can mail me at this mail ID. So let's get started. It all begins with a smile. Since mouth is one of the focal points of the face, a smile plays an important role in how we perceive ourselves as well as the impression that we make on the people around us. As Fresh has stated, the acceptance of treatment by the patient is actually made much more easier when prosthesis accomplishes two basic needs, that is portrayal of physiologic norm and actual improvement in the attractiveness of the smile. And patient evaluation is the first step that is to be carried out in treating a patient. So before we begin with our primary impression, we have to be very well known with the expectations of the patient, especially in a complete denture case. And Jamieson stated that fitting the personality of the aged patient is often more difficult than fitting the denture to the mouth. The mouth as a separate entity lends its personal touch to the personality appearance of the whole individual. So both the denture base and the teeth must be considered with equal measure. And the complete denture prosthodontist has more to do with the beauty of a face than any other beauty specialist. That is, the appearance of the entire lower half of the face depends upon the denture. And also the psychological importance of a pleasing dental appearance is very clear and is often discussed regarding the denture success. Coming to the definition, so aesthetics is a Greek word. Aesthetikos means perceptive, and as per GPT-10, aesthetics is the branch of philosophy dealing with beauty. In dentistry, the theory and philosophy that deal with the beauty and the beautiful, especially with respect to the appearance of a dental restoration as achieved through its form and or color, those subjective and objective elements and principles underlying the beauty and attractiveness of an object, design, or principle. Denture aesthetics can also be defined as the cosmetic effect produced by a dental prosthesis that influence the desirable beauty, character, attractiveness, and dignity of an individual. Now, let us discuss the fundamentals of aesthetics, that is visual perception, composition, proportion, dominance, and illusion. Let us see what these are. The first one, that is the visual perception. So we know that the organization of sensory data is through 5 senses, that is the sight, touch, hearing, taste, and smell stimuli. And the visual perception, the stimuli is brought about by rods and cones, and scientific studies have resulted in the formulation of certain principles or parameters of visual perception, which provides the basis for the elements of aesthetics, which are called as the Gestalt principles. which include proximity, similarity, symmetry, continuity, figure, ground, and closure. We don't have to go in detail about this. So this is about visual perception. The second fundamental property of aesthetics is composition. Is the relation between objects made visible by contrast. So vision is possible if eye can differentiate, which is possible only if there is contrast. An increase in visibility is proportional to the increase in contrast. Now, in dentistry, we use this terminology in dental composition, dentofacial composition, and facial composition. And the contrast, it can be in size or it can be in color. We have discussed in detail about this in Smile Designing PPT. And there we said that harmonizing an aesthetic smile requires a perfect integration of facial composition and dental composition. Now, this facial composition includes the hard and soft tissues of the face, and the dental composition relates more specifically to teeth and their relationship to the gingival tissues. Whereas dentofacial is the relationship of teeth and soft tissue in static and dynamic muscular position. Now, the prime requisite of composition is unity. Unity means oneness, that is, harmonious arrangement of different elements to give the composition the effect of wholeness or completeness. Next, the third fundamental property is called as the proportion. So, the concept of beauty has most often corresponded to a harmony in proportion. And we have already discussed about the aesthetics and golden proportion again in the Smile Designing PPT. And this application of the golden number to dentistry was first mentioned by Lombardi and developed by Levin. And according to Lombardi, when viewed from the facial aspect, the width of each anterior tooth should be 60% of the width of the adjacent tooth. So the mathematical ratio will be 1.6 is to 1 is to 0.6 respectively for maxillary central, lateral and canine. Now, in the simplest form, the golden proportion, it is defined as a proportion between the larger part and the smaller part. So, when the ratio between central and lateral is in golden proportion, then the centrals should be 1.618 times larger than the laterals. So, this is about golden proportion. Dominance. Just as unity is the prime requisite for a good composition, dominance is the prime requisite for providing unity. And the color, shape, and lines are characters that create dominance. Dominance exists when a strong centralized structure is surrounded by a well demarcated characterized structure. Example, the central incisor, which is the most dominant element in the dental composition. And similarly, mouth is the dominant feature of the face, and it dominates by virtue of its size, mobility, and psychic association. Now, the amount of dominance to be given to the mouth by the dental composition depends actually on the patient's personality and strength of background facial features. Now, coming to the final fundamental property, that is illusion, which is one of the most important objective of aesthetic dentistry. And these are created using following three techniques, that is shaping and contouring, arrangement of teeth, and staining. Like the illusion created in this drawing, the perception and manipulation of light are used in cosmetic dentistry by staining, shaping, and contouring the dentition. We have already discussed different types of illusion, that is widening illusion, narrowing illusion, lengthening and shortening illusion in detail in our Smile Designing PPT. Now, coming to complete denture aesthetics, let us see the factors influencing the appearance of complete denture. So basically there are three factors, that is the patient factors, the tooth factors, and denture base factors. Now, we have already said in the introduction, the complete denture prosthodontist has got more to do with the beauty of a face than any other beauty specialist. That is, the appearance of the entire lower half of the face depends upon the dentures. Now, let us see these factors in detail. The first one, the patient factors. So it was Claire F. Picard who said that before attempting to achieve the goal of a natural and pleasing expression with complete denture, it is essential to make a thorough study of the normal facial landmarks first. And he listed around 11 facial factors which are all considered to be significant in producing a pleasing harmonious facial expression. And they are the relative overall state of the face, proportions of the face and the ratio of the facial dimensions, the profile, the outline form, the mouth side, the commissure length and form, thickness, form, curvature, prominences, and tenseness of the lips, the creases and folds in the facial tissue, squinting of the eyes, breadth of the nostrils, spatial position of component elements of face, nose, eyes, mouth, and chin, and finally the facial impress. And along with this, the surface anatomy of the face in relation to complete denture was also found to be significant, and several anatomical features like the alanacy, the nasolabial groove, the upper lip, the rima oris, lower lip, mentum, mentolabial groove, philtrum, nostrils, apex, nasi, etc. were being considered to be significant. And also the mechanical aids like pre-extraction records are highly significant, and they not only indicate the tooth position but also bone structure which forms and support these facial features. And so photographs of patients before the loss of natural dentition will give the dentist an idea of the expected outcome. And so he must take into consideration the age of the patient and any other factors that may have altered the patient's facial expression. Next, the factors relating to the teeth for denture aesthetics are form, shape, color, arrangement, and sex. So these factors we will be discussing in detail in our coming slides under the teeth arrangement section. Finally, coming to the denture base factors. Now, aesthetic denture bases are mainly indicated for those with an active upper lip, the patients with a prominent premaxillary process, theatrical performers, singers, and others who may expose normally unobserved gum tissue areas. And it's also important to have a positive psychological effect on the patient and the dentist. Now, the denture base factors can be mainly two, that is the contour of the denture base and the color. Now, denture color charts are available that provide a guide for selecting the right shade. It helps both the dentist and the patient match the real teeth or the desired outcomes. Now, these charts showcases shades from light to dark considering factors such as age, gender, and skin tone of the patient. And the shades of acrylic resin range from a very pale pink to a strong red and from a light blue to a strong brownish purple. The next is the contour of the denture base. So benefits of properly contoured denture bases are there is improved tolerance and comfort. It facilitates stability and control and also prevents chronic biting of the lip or cheek. Now the flanges of dentures, both buccal and labial, are important in creating facial contours, and these flanges can be altered to give a fullness or shallowness to the surface anatomy of the lower half of the face. But one thing to be noted is that this alteration should not be carried to the extent that the function is impaired, since denture function is of primary importance. Next, coming to the steps in complete denture fabrication that help us to achieve aesthetics. So the first and foremost step is an accurate impression, then the jaw relation step, the selection and arrangement of teeth, and finally denture characterization. Now let us discuss one by one in detail. Firstly, an accurate impression. So we very well know the role of a primary and a secondary impression technique in delivering an effective complete denture both aesthetically and functionally. And the thickness of the labial flange of both dentures is usually accomplished at the impression phase of treatment in order to achieve proper aesthetics, retention, as well as stability. Here you can very well see how much the aesthetics has been influenced by an increased labial flange thickness. And the border thickness also should vary with the needs of the patient depending upon the extent of residual ridge loss. So usually a long-standing edentulous patients require thick denture borders because of increased residual ridge resorption. And also the vestibular fornix, which is a slit-like space between the lips or cheeks and the teeth, should be filled but not overfilled to restore the facial contour. And nowadays, digital dentures uses the accuracy and capabilities of the CAD/CAM technology and the 3D printing technology to produce extremely accurate and aesthetic dentures, which are considered to be 2 times faster than the conventional denture fabrication procedures, and also they require less patient chair time. The next important step is jaw relation, and here we determine the amount of separation between the maxillary and mandibular residual ridges, and by properly establishing the vertical dimension of occlusion, we restore the normal physiological length to muscles and allows normal facial expression. And re-establishing the appropriate vertical spacing will also improve the patient's facial profile by decreasing the sunken and aging appearance. This vertical space must not only be aesthetically pleasing, but also it should be compatible with the typical mandibular joint apparatus, including the muscles of mastication. Now let us see the consequences, what happens when the vertical dimension is increased or decreased too much. As you can see in this picture, there is increased lower facial height, and so there is an inharmonious facial proportion, and because of this there is increased trauma to the denture bearing area because of the accelerated residual ridge resorption. There will be difficulty in swallowing and speech, pain and clicking in the TMJ and muscular fatigue because of the overstretching of the muscles, and even there will be clicking between the teeth during speech and mastication. And there is increased nasolabial angle. The patient will have a sensation of a bulky denture, and also the dentures may be unstable due to the excessive height. Whereas in decreased vertical dimension, again the lower facial height will be decreased, and so resulting in an inharmonious facial proportion, comparatively lesser trauma when compared to the increased VD. And also when the vertical dimension is decreased, there is difficulty in swallowing and speech, again pain and clicking in TMJ and muscular fatigue, and there is loss of muscle tone, presence of wrinkles and folds which are not because of age. The nasolabial angle here, it's less than 90°, and there is chance for angular cheilitis due to folding of the corners of the mouth, and there is cheek biting and also thinning of the vermilion borders of the lip. The next step is teeth selection, which is very important, as the selection of appropriate shade, size and form of the artificial teeth determines the aesthetic and function of the denture. Anterior tooth selection considers size, shape, color and material, that is basically to satisfy aesthetics, whereas in posterior teeth they are chosen based on color, size, cuspal morphology and material to aid in mastication and denture stability. So here we give importance for the function. Now let us discuss the factors that are considered during the selection of anterior teeth in order to satisfy aesthetics, that is the size of the teeth, form of the teeth, color or shade of the teeth. The first one, the size of the teeth. So the tooth size, it should be appropriate to the size of the face and sex of the patient, and there are various methods which can be used as a guide in anterior teeth selection. One is the method using pre-extraction records like the diagnostic cast, previous photographs, radiographs, extracted teeth as well as previous dentures. Then methods using anthropological measurement of the patient like the anthropometric cephalic index, where you can find the total width of the anterior teeth by dividing the circumference divided by 13, as well as there is Burry's biometric index, where the width of the maxillary central incisor is equal to the bizygomatic width by 16, and several other indexes. Then the methods using anatomical landmarks, where you use the size of the maxillary arch, the location of canine eminences, location of buccal frenal attachment, and the location of the ala of the nose, etc., to find out the size of the teeth. And then methods using theoretical concept, where there is Wingler's concept, the Tipalform theory by Leon Williams, the temperamental theory, etc. And also there are other factors that influence selecting the size of the teeth, like the size of the face, amount of available interart space, the measured distance between distal of right and left maxillary canines, the length of the lip, size and relation of arches, etc. So all these methods can be utilized in order to find the size of the teeth. And anterior teeth selection is a very important short note that you can expect for your exams. So in that you have to discuss in detail all these methods that can be used to select the size of anterior teeth. So if you need a separate session on anterior teeth selection, you can comment below this video. Next, coming to the form of the teeth. So the form or outline of anterior teeth can be determined using the following factors. That is, the first one, the shape of the patient's face or the facial form, and the facial profile, and SPA factors. So these SPA factors we will be discussing in detail in our coming slides under the dentogenic concept. So coming to the facial form or the shape of the patient's face. So this is based on the Tipalform theory by Leon Williams, and according to him, Facial form can be of 4 types, that is ovoid, tapering, square and combination of the above. So the selection of the anterior teeth should be in harmony with the facial form. As you can see in the picture, ovoid teeth are preferred for patient with an oval face and tapering teeth for a patient with a tapering face. And he also said that the shape of the teeth should be inverse of the shape of the face. That is, if the face is tapering downwards, then the teeth should be tapering upwards, as you can see in this picture. The next is the patient profile. So the patient may have a convex or a straight or a concave profile, and so the labial form of the anterior teeth, it should be similar to the facial profile of the patient. As you see in the picture, the labial form, it can be straight for patients with a straight profile and it should be convex for a patient with a convex profile. Finally, coming to the color or shade of the teeth, which is particularly important for anteriors. So before selecting the color or shade of the teeth, we have to know about the basic concepts about the color. So there are 3 dimensions of color, which are hue, chroma and value. Hue means a specific color produced by a specific wavelength of light. Saturation or chroma, it is the amount of color per unit area of an object, and brilliance or value, which is the lightness or darkness of an object. Similarly, there are different properties of color like opacity, translucency and transparency, metamerism, fluorescence, etc. So we have discussed in detail about these dimensions and properties of color in our smile designing presentation. So please go back to it and watch it to have a clear-cut idea about these. Next, the factors that influence the color are age, habits, complexion, color of the eyes and color of the patient's hair. So we know that young people have got a lighter teeth where the color of the pulp is shown through the translucent enamel, whereas in old people it is much more darker and opaque due to deposition of secondary dentin. And also the old people might have a more shiny teeth as they get polished due to regular wear of the teeth, and also sometimes they show a brownish tinge because the exposed dentin tends to stay. Next is habits. We know that smokers, alcoholics, pan chewers, etc. have got discolored teeth due to stains. So it is better to select porcelain teeth in such patients because they are not porous and they do not allow percolation. Coming to the complexion, so the color of the teeth should be in harmony with the complexion of the patient, particularly the complexion of the face. The color of eyes and color of patient's hair are much more unreliable factors because the eyes are too small and they are located far away from teeth to significantly influence the choice of color. And also the color of the hair, it may change because of the use of cosmetics and also with age. So these two are unreliable factors. Next, coming to the arrangement of teeth, which we will be discussing in our next session. Thank you all for watching this session. I request every one of you to please do like and share my videos. And if you have any queries or feedbacks, you can either comment below this video or you can mail me to this mail ID. And if you are new to this channel, Prostho Hub, please do subscribe to it and support me. So it's a bye from Prostho Hub until our next session. Thank you.